No mai, haere mai, and welcome to the emergency department. Patients may arrive into the emergency department, or ED, in a number of ways. They may walk in or be dropped off by whānau at the entrance. They may come by ambulance, or if they're coming from a further away or a tricky-to-reach spot, they may arrive by helicopter. When you arrive at the ED, the first step is to see the nurse. Please let the nurse know if you need an interpreter or other support so we can best care for you. The first nurse you meet is called the triage nurse, and they will ask you some questions about your condition and do a quick check. This is so that we know which patients are most unwell. They'll need to be seen first. Patients with a severe or life-threatening injury or illness are usually taken straight through to the resuscitation area, or resus, for immediate treatment. You might not see these patients come into the waiting room, as they may arrive through a different entrance. Some patients will be asked to sit in the waiting room. Others may be taken into other parts of the ED. At times, our ED might be very busy. If the nurse has identified that your condition is appropriate for you to be cared for at a local urgent care center, we might offer you a voucher. There is likely to be a shorter wait time there. You are welcome to stay in the ED if you choose. Before taking a seat in the waiting area, you'll need to see the administration clerk to complete your registration. The next person you will meet is the clerk, who will ask you some questions that will help with the process, such as your name, date of birth, contact details, etc. If your condition is more urgent, you may be taken through to another part of the ED. In this case, the administration clerk will come to you. Often, patients who are more unwell may be seen before you, even if you got here first. If your condition is less urgent, you may have to wait a bit longer to be seen. While you are waiting, please know that you can connect to the free hospital Wi-Fi. During this time, you will also have a more detailed assessment by a nurse. At this stage, pain relief and tests might be started. Please let the nurse know if you need any other support, for example, cultural, access needs, care support, etc. You may be asked to take a seat back in the waiting area after this assessment, or you may be taken to another area if you require more urgent treatment. We understand waiting can be difficult. Please know our teams are busy working to make sure they have all the right information to give everyone the best care. We have not forgotten about you. We're busy preparing your treatment bed or chair and caring for other patients in the department. Even while you're waiting, the nurses are constantly keeping an eye on you and your condition, but it's important to let us know if your symptoms change or get worse. If you need to go to the bathroom or leave the emergency department for any reason, just let the nurse know. Getting to know you and assessment. You will be invited through to the treatment area, where we can get to know you better, understand your situation, and continue with your care. You may be able to bring a whānau member or support person in with you. Please check with our staff. Kia ora. If you're a support person, please know that you are valued and welcome in ED to support your whānau. The doctor or nurse specialist will gather more information to help decide what other tests are needed and the best care for you. This may take some time. Treatment and care. The team will discuss with you and your whānau how we may best care for you. This may mean getting a cast for a broken bone, getting a prescription for some medicines to take home, or staying in hospital for more tests or specialized treatment. If you need to stay in hospital, you will be admitted to one of our wards or transferred to another hospital. If you are well enough, you will be discharged home. If you have any further questions, this is a great time to ask. On discharge, your care notes from your time with us will be sent to your GP. We encourage you to follow up with them to review your progress. We're all here to care for you. Thank you for your patience while you wait. We try to see everyone in a timely manner and will get to you as soon as we can. Ka kite ano.